Okay, we're getting ready to start Natalie's Botox. We have the syringes with Botox, which has been mixed from the small vial, which has just a tiny bit of powder in it. You mix it with saline and then draw it up in the syringes, and each syringe has about 25 units of Botox. These are brand new needles. And once we have Natalie in position here, let me have you lift your chin up just slightly. There you go. Then we can go ahead and have her again make those motions, that frown. Watch where the muscle grabs the skin and relax. And then once she's relaxed, then we'll start the injection. I like to put my finger right here to kind of put a little pressure because it makes it a little bit more comfortable for patients. And here we go. Again, that corrugator is really deep, so you have to have the needle almost all the way in to really get the corrugator fibers. And then to catch the tail of her corrugator out here. And then we'll hold just for a second so that we don't get any bruising. It's pretty unusual to get any bruising in this area with Botox. Occasionally in the crow's feet area along the side of the eye, there's a little bit more tendency to bruise there because there's more little tiny vessels. But typically patients can have Botox and go right out afterwards, and there's no problem with that. Botox actually takes 2 to 3 days before it starts to work, and usually 2 weeks before the effect is full. We're going to do just a tiny bit in that center area there, just put a few units in. And that one again is more superficial because it runs over the corrugators. And next we're going to do a little bit of brow lift, a chemical brow lift with Botox, by just injecting a little bit along that orbicularis muscle. So the first thing I'll have Natalie do is squeeze her eyes closed really tight. And you can see how her brow is pulled down. Relax. So you look where the most motion is. I put my finger right under that brow bone. And this is a very superficial injection because the orbicularis is a broad muscle that is just barely under the skin. That's why it makes so many fine wrinkles. So you can see here we've done just a fan of injections right along there. You don't want the Botox to diffuse too far, so I tend to do a few more injections. It gives you a little bit more sting, but I think you get a better effect by doing that, and you get the Botox to work through the muscle better than if you just treat it in a couple places. So we're going to go ahead and finish Natalie's injection here. And again, raise your brows up. You can see Natalie has deep attachments here, but a shorter forehead, so she doesn't take a lot of Botox to knock out most of her frontalis muscle because it's not very big. And relax. And here we go. In some patients, their frontalis muscle is very deep, and it goes very high and very far out to the side. And in those patients, we're going to need a lot more Botox. And raise again for me, and relax. And raise again, and relax. Okay. This shows the areas where we just did Natalie's Botox. This area here is the frontalis muscle, and the injections that we placed in the frontalis muscle to decrease those horizontal wrinkles, and it will cause some relaxation of the brow. These areas here in green are the orbicularis injections, and those will cause a decrease in the crow's feet and a little lift in the brow. And then this area here shows the deep injections that were in the corrugator muscle, and then in the procerus to decrease that frown line makes the vertical creases between the brows and makes patients look mad or angry. We just finished doing Natalie's Botox, and Natalie's our patient coordinator, so she talks to a lot of our patients who are interested in getting Botox and have a number of questions about Botox. So I've asked her to tell you some of the most common questions that patients ask her about Botox.
One of the main questions that patients will ask me on the phone is, does it hurt? And having gone through it, I can tell you that it is very tolerable and very minimal, if any, pain at all when it comes to the injection. One of the other main questions that patients will ask is, what is Botox? Is it harmful to me? Will it hurt me long term?
Botox is a toxin, but much like the vaccines that are bacteria that have been inactivated so that when you inject them you don't get the sickness that the bacteria would otherwise cause, Botox is a toxin that is inactivated. So when you inject it, it doesn't cause the same paralysis or problems that would be caused by the actual botulinum toxin. It's close enough to the toxin that when it reacts with the muscle, it causes very localized paralysis of the muscle. And Botox has been used for 20, 30 years in the ophthalmic field for patients that had spasms of their eyes, and that's how they first discovered that it could be used for cosmetic purposes. So many years before Botox was introduced as a cosmetic alternative to wrinkles, Botox was used for patients that had what we call blepharospasm. So its safety and efficacy has been demonstrated with hundreds of thousands of patients over many years.
One of the last questions that a lot of patients will ask is, will I get a frozen look to my face or an unnatural look to my face?
I think that many patients are concerned about that frozen look, and sometimes it's because they've seen other people that have a more frozen look, and certainly I have a few patients who definitely want no motion at all. So it's very individual, but I would say the majority of patients like to have a little bit of motion. They want it to be subtle, they want to look natural, and you can certainly do that with Botox. It can be used to just eliminate the wrinkles or just eliminate certain muscular functions that make the face appear more relaxed, more natural, more soft, less mad or angry looking. It's really not something that's intended to make the face look like it doesn't animate or that you're unable to make any of those facial expressions.